Good afternoon. I'd like to call the meeting to order for March 17th for the Community and Public Health Committee meeting.
And I'll call the roll. I'll start with you, Commissioner Gerardo,
Present.
Commissioner Christian,
Present.
and Commissioner Salgado.
Present.
All right, thank you. I'll read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to the approval of the December 17, 2024 meeting minutes.
I motion.
Second,
Second.
is there any public comment in the room? All right, all those in favor?
Aye.
All right, the minutes are approved. Thank you. We can move on to item 3, the San Francisco Health Code, Article 38, Air Pollution Exposure Zone Update. I'll pull up the presentation.
Great. And you'll move me through?
Yes, just say next slide, please.
Thank you so much. Hi, good afternoon. I'm Jen Calloward. I'm the Assistant Director to the Environmental Health Branch under the Population Health Division. And we're here to talk about Article 38, Air Pollution Exposure Zone Update. Next slide. We obviously appreciate this opportunity to provide an overview of the program and the air pollution exposure zone we have updated in 2025. As you're aware, no action is needed by the Commission on the changes, but truly appreciate any feedback you may have for us. We will also review the public comment that has come through on the update of the map, and then also some next steps. So just a quick overview. This is where environmental health lands under the Department of Public Health. We're under the Population Health Division, the director being Dr. Susan Phillip. And then next slide. But more specifically, we're under Public Health Services with Patrick Fosdal as the Director of Environmental Health. Next slide. So bear with me. I think some of you have maybe seen this slide before. It's a pretty dense and technical program. We can definitely have questions at the end, and I'll try to do my best to go through it to explain it as best I can. So really protecting public health through an air pollution exposure zone is the breadth of this ordinance. So we call it the APEZ, and it's an area over the city which substantially greater concentrations of air pollution with PM 2.5, and will include at a minimum criteria for maximizing the allowed excess cancer risk and maximum PM 2.5 concentration. So when we in addition, so what the APEZ does is that if it requires new development or major renovation within the zone with sensitive receptors such as housing, schools, childcare, adult daycare, to include enhanced ventilation that would have filtration such as MERV 13 or the equivalent. And it would provide positive pressure to make sure that the outside air doesn't come into the building. So I want to be really clear about what projects need to comply. And so if you have a sensitive use building and they have a major renovation, which is 25,000 square feet or more, so that's a pretty big renovation, would trigger the enhanced ventilation. If you're constructing a new building altogether, in the APEZ, that would trigger the enhanced ventilation. And then in addition, if there was a change in use, so if it was one, just maybe an office building, and the planning department had required a change of use, then that would require to go into residential or the other sensitive uses I mentioned, that would require the enhanced ventilation. Next slide. So I'm going to take you down a quick trip on memory lane. This law is from 2008, and it was adopted then and created an enhanced ventilation filtration requirement, but we left the builder responsible for doing the modeling to determine if it complied with the thresholds of the PM 2.5 thresholds. At that time, the law was only applicable to residents with 10 or more units. So it really had a smaller scope of people that would be able to benefit. So next slide. So in 2014, we reassessed the program, and we really launched a very extensive community outreach and stakeholder involvement. There was several challenges that we were having since 2008. One being not all the residents were protected equally. As I mentioned, there was, you had to have 9 units or 10 units or more to be able to have the enhanced ventilation. And then we also only were protecting residents. We weren't looking at childcare or anybody licensed by the California Department of Social Services, like the adult daycare. We also weren't looking in terms of an equity lens of the smaller developers that had the burden of the cost of actually producing the models. So with the stakeholder engagement, we worked with land use commissions, developers, the Municipal Green Building Task Force, and several neighborhood associations to get feedback. It resulted in, obviously, the residents were for it, the mechanical engineers were for it, the developers were not as strong of supporters, as you could probably see, because it costs money to put in these systems, and you lose square footage for units. But in turn, they didn't have to pay for the modeling. So finding a consultant to model for them, which is very expensive, or they would pay the department to model. So it was really a win-win, and the law passed. The amendment passed in 2024. And we've got, next slide. This was the resulting new APES. In addition, we had as part of it, we were modeling, we're required to model every 5 years. So this is why I'm here with you again. We're at that time. But also, we added in more emission sources. So it was beyond just the transportation. And we put in another layer of health vulnerable locations. So a health vulnerable location is 5 zip codes with the highest level of respiratory and cardiovascular related hospitalizations and non-accident mortalities. So the whole city had a threshold when you laid the air pollution model across the whole city. Whatever area was 10 micrograms per cubic meter or more, you landed in the APES. If you were in the zip code and you were at anything over 9 micrograms, you got included. So we had a weight put on in terms of hospitalizations, and that would include like asthma, asthma visits, cardiovascular related visits. Okay, next slide. All right. And then 5 years passed and we were at 2020. We again went through a robust stakeholder engagement process. This time we were adding point sources from the Bay Area Air District and maritime emission data, as well as the ground transportation emission. And that gave us a new, much more expansive layer, but that's not just because of the point sources. The EPA had lowered the recommended threshold, so just more got captured in the model. All right, and then we also included locations within 1,000 square feet of roadways. All right, thank you. Next slide. Okay, so here we are, 2025. I think you might recall between 2020 and 2025, we had a pandemic, and there was a real disturbance on travel, roadway use, and really the resources spent. So we had to make a decision of what we were going to do when we were updating this model. So in February of 2024, the EPA actually announced this decision to lower the current threshold again. And instead of being 12 micrograms per meter cubed, they went down to 9, which, if you recall, is what the vulnerable populations threshold was in our 2020 map. We didn't have good traffic measurements at this time. So we decided to reduce the threshold for the entire city to 9 micrograms per meter cubed. So that's where we have expanded the parcels that are included in the new APES. And then in addition, we have the 1,000 feet of roadways with daily average of 100,000 vehicles or more. That added a few more parcels when we put in that layer. Next slide. I wanted to talk a little bit, it's worth mentioning, we had a public comment period of 30 days. We received 2 public comments, one from the Bay Area Air District and another from the Bayview Hunters Point AB 617 Steering Committee. DPH has members on that committee that are actively engaged. And I want to read through some of their comments for transparency. The 2025 APES map should be expanded to include the 1,000-foot buffer, which I think we just explained that we did add that in. Asthma prevalence should be included as a health risk and a health driver to identify health vulnerable zip codes. And we definitely agree with that. And using hospitalization data is a good method for that. The source emissions data that underlies the 2025 APES is based on the 2014 source emissions, and they're really looking for updated emission sources. And then they recommended to review the most recent available data by the Air District. Emissions inventory should utilize community-based participation and resources to better understand and characterize air pollutions in the Bayview Hunters Point. And then lastly, the 2025 APES does not include emissions known as an impact to the Bayview Hunters Point, including ships in the bay on their way to other ports, such as Oakland or Redwood City, and then other emission sources, including wood burning, commercial and residential cooking, construction emissions, and indirect sources. So as I mentioned, due to the low traffic patterns and resource constraints on all the partners and resources during this 5-year period, we were not able to produce an updated emissions data or hospitalization data, unfortunately. But we were able to add the 1,000-foot buffer. DPH will be providing a response to the steering committee through our DPH committee member, and we're committed to partnering with the steering committee and the Air District, who leads that committee, with the Bayview group to incorporate updated emission sources and hospitalization as we move forward. Next slide. Sorry, it was highlighted. Perfect. Thanks, Mark. It's important to note there's some new news that we're just finding out in DPH and environmental health around the building, California Building Energy Code, and the there's a 2025 update that goes into effect in January 2026. And it's actually going to require MERV 13 for all multi-unit dwellings, residential dwellings in the state of California. So really, and then along with schools and commercial buildings. So what that means is that the residential buildings built in San Francisco will be required to have MERV 13, whether you're in or out of the air pollution exposure zone. So that's really big. And then another next step is we definitely want to partner with the Bay Area Air District and the steering committee and the planning department to compile a full list or a comprehensive list that we can find of PM 2.5 emissions for future modeling. And then we also, based on the state data, we might be, or state change and code, we may be considering a code cleanup to better represent what Article 38 can do for the community. So at the end of it, under Article 38 in 2026, this would only leave single-family homes and child and adult daycares under environmental health and DPH's purview. So we're moving in the right direction because it would be required through the building department. Next slide. So really appreciate your time and here to answer any questions. Or try.
Thank you for the presentation. Really interesting and obviously very important. Just starting with one of your last comments, can you just repeat and say a little bit more about soon, the only buildings that will be under DPH's supervision, single-family homes and
adult and child care facilities. So in 2026, the plans would come through the Department of Building Inspection, and if it's anything of 2 or more residential units, they would automatically be requiring it, the advanced ventilation. So, but there is an exemption at the state level for single-family homes, which makes sense as a statewide level, just because of the diversity of how counties are and the density of counties.
Great. And when you answered just now, you answered part of one of my other questions about what 2 or more meant. So basically, if you have a house that you live in and there's a rental unit, that will fall under it.
Correct.
Okay,
Yep.
good to know. It would be helpful, it'd be interesting going for after this, if you could provide us with the full list of public comment and the responses, just more detailed. I
Sure.
appreciate, the fact that you distilled it down for the presentation, but it would be interesting and helpful as a learning experience to have that for us.
No problem.
And will there be, or is there a current vulnerable population level that will be established the way that it used to be in prior years?
Yeah, I mean, we'll definitely use some of the methodologies in the past, but I think it is worth, since we'll have a good amount of time to really look at what is appropriate in terms of like the cancer risks and all of that. I don't know how much that has changed since we did this in 2014. But yeah, it will be looked at.
Mm-hmm. And to the extent that, now we're going to still have people who fall outside of the regulations in terms of the requirement for ventilation upgrade, will that information be provided to the general public for people? Let's say I live in a building that won't fall under the requirements, but it would be good for me to know that maybe it would be worthwhile for me to consider getting an air filter of my own.
Yeah, there's no
that I live in an area.
Yeah, so the air pollution exposure zone is on the planning information map, which is a public platform, but you would need to have a computer, you would need to have the website. So there it is there, but we don't have a mechanism right now to, it's not like required and by a landlord to
Mhm.
like, it's required to the landlord to say that they're in an APES, but I'm not sure, I don't know about the purchasing of a home. But when you lease a place, it is required.
Okay, well, that's good to know. I wasn't thinking that it should be the requirement of a landlord or per se, but just that the information be publicly available to people so that, and not in a way that they have to search for it and then buy something in order to access it. So that we, people, because air pollution, I can't tell you more than you know, how important it is to health.
Yeah.
And that people be able to have as much information as we can give them so that they can make decisions on their own.
Yeah, the PIM is really great. Sorry, property information map. You can look up your address and you can find out everything there is to know about the property, whether it's
Mhm.
historic, who
Mhm.
has owned it before, assessor's records, and then it does have an environmental tab, and you can see whether it's in or out of the APES and at what year. We have all the different layers,
Mhm.
2014 through 2025.
Well, that's great information, and I'm, learning about that, or being reminded about it from your last presentation.
Yeah.
I just think it would be really a public service, perhaps on the department's website, to have some, basic information, or given that digitally, it's not really that difficult to add links, to provide a place where people can see and go and see and get information and learn things.
That's great. Yeah, I can think about that. We just redid our website, so
Mhm.
there's definitely, it's by interest rather than everybody siloed. So, great feedback. Thank you.
Thank you so much for the presentation, and huge gratitude for you for providing the org charts and detailed two-level. Thank you. It's very helpful. It's a big
You're-
department.
You're welcome. Yes, it is.
Thank you as well for this. It's a very informative presentation. I have a few questions. What agency, or is there an agency that monitors and enforces compliance with Health Code 38 and the Environmental Chapter 25?
Yeah, so Article 38 is enforced by environmental health. So
Okay.
that's under Director Fosdahl in environmental health. And then Chapter 25 is part of the Environment Code, which is outside of DPH. That is enforced by Public Works. So they have a code compliance section. So it's for all Public Works projects have to use clean construction. And then the planning department can oversees that as well. So they can check to make sure that they're using the clean construction and following that.
So if construction or some remodeling of a building, DPH determines is out of compliance, what do you do?
We would issue an NOV, and then we have a formal administrative enforcement process with a director's hearing, administrative fines, and so forth. Yeah, it will follow the same path, whether you're a restaurant or a massage facility or a hazardous materials site.
You probably don't have this, but I'm curious, in the last year, how often did the out of compliance happen that you had to deal with it? Or
We don't have anybody out of compliance because we have like a fail safe. So people, we have partnered with the building department, so they will not issue a mechanical permit and a building permit unless they have our attached letter saying that they're in or out and what they're going to do, and then our review saying that your plans are compliant. And we look through the mechanical plans and we stamp them. And then the building department is responsible for during their final to ensure that it was installed. So in the last year, we do have a complaint-based it's a complaint-based program. I think maybe 2 or 3 times since I've been involved in the program, we've had a complaint from a resident saying that the filters weren't being changed. And so we have a team that goes out and can address that.
okay, so that's how then, I always like to kind of bring it down to the base. That's how DPH then interacts with
The
with
building.
this.
Yep,
with
the building
Lopez
management.
is in this way.
Yep.
Okay. Now, you may, and this may have nothing to do with you, but I don't know. So I guess it was the New York Times, whatever, a couple days ago, that our current Washington administration with the EPA wants to get rid of the Environmental Justice Unit. And it noted different projects, et cetera, and this, such as Bayview Hunters Point, et cetera. Does that impact what you're doing if in fact this is eliminated? I don't know. Since I was reading this for our meeting, I wanted to just raise the question, and what the article stated is that vulnerable populations did not really need to be considered. So I don't know if
Yeah, I can't speak to the article, but I know
know.
that our Article 38 would not be affected.
it
Yeah,
would not.
no.
Okay. Just the toxic cleanup at Bayview. So, okay. Well, thank you very much. And how you put together the presentation was extremely helpful in
Thank you.
understanding, what you're doing and why you're doing it and the updates. So thank you very much.
Thank you, Commissioner.
Think can we move on? Oh.
Yeah, one more, sure.
Thank you. Just, I don't know what you can tell me about a situation like this, but let's just say there's construction going on in the city and it's the city working on the road or sewers or something like that. And a lot of dust, a lot of like white dust is produced, concrete probably, concrete perhaps. What is supposed to be done around a situation like that prior to that construction, during to that construction? Anything probably doesn't have anything to do with you, but do you have any sense of?
There is a dust control ordinance. I'm not the subject matter expert. Director Fosdell could speak to it if you'd like him to, but
It's not necessary.
yeah, there is a dust control ordinance and we are involved with that.
And you probably get involved on a reporting level or also on a planning level?
It would be compliance and monitoring.
Okay.
Yeah.
Thank you.
Thanks. All right.
Thank you.
Thank you. We can move on to item 4, data from National HIV Behavioral Surveillance. Violence is a public health emergency for trans women in San Francisco. And I will pull up the presentation.
Hi there, I'm Erin Wilson. I work in the Center for Public Health Research. So I'm here today to talk about some exciting data we've recently been able to analyze from our National HIV Behavioral Surveillance Study, which is a grant that comes to 23 cities across the United States to monitor the HIV epidemic in communities most affected by HIV. It's also a really important data set for understanding social determinants of health. They've expanded the survey broadly to include a number of social determinants. We've used those data to look at intersections between HIV and a lot of factors like housing, substance use, things like that. We were able to garner some additional funding to look at violence specifically. And so those are the data I'll be presenting today. Next slide, please. So this is where we sit in the Population Health Division in the Center for Public Health Research. The director is Dr. Willie McFarland, who's here today. Next slide, please. And more specifically, we're here in division with research, learning, and development, which is a group, a collective of units that do a lot of research specifically on HIV, but lots of other training and social determinants-based HIV and other research. Next slide, please. So I've been working at the center for about 15 years. This is a little map of some of the research that we've garnered extramural funding to supplement and complement the work of the health department around monitoring HIV among trans communities. Our research is exciting because it comes from the community. In 1997, community members came to the health department to say we weren't being counted in the HIV epidemic, and we demand to be counted as such. And so we've carried on that tradition of a community-based participatory research to expand on a volunteer basis, and then eventually funded by the Centers for Disease Control and Prevention to include monitoring the HIV epidemic among trans women specifically, who are highly impacted by HIV. So we've been doing this work called TEACH that was started by the community. It stands for Trans Empowerment to Advance Community Health. And like I said, we've garnered funding from a number of resources outside of the health department, from NIH, CDC, HRSA, SAMHSA, to understand the epidemic more broadly. We know that violence is a huge intersection with HIV in our community here. So we were able to garner some ancillary funding from the Robert Wood Johnson Foundation to specifically add on questions related to violence. So next slide, please. So I'm sure folks know here, violence is a public health epidemic. It's the leading cause of death for people under 45 in this country and many places around the world, by unintentional injury, by other sources of violence, including suicide. This violence epidemic continues, unfortunately, and it's a very important epidemic in our city as well. Next slide, please. Unfortunately, trans folks, compared to cisgender folks across the US, kind of zooming out, experience twice as much violence as cisgender people. So violence is particularly high in trans populations in the United States broadly. Next slide. And in California, unfortunately, that's the same situation here. And I'm missing a 2 here, but the findings from the California Violence Experiences Survey found that trans folks report 7 times more likely to experience violence than cisgender folks in our great state of California. Next slide, please. And in San Francisco, a lot of trans people, of course, are born here, but also come to our city for a lot of reasons, including care, but also because it's perceived as a safe haven. These data are asking just one question about violence experienced over time with different cohorts of trans women. And you can see more than half of trans women come to the city or experience violence in our city. Next slide, please. So what are the sources? So we understand what we're talking about when we talk about violence is childhood abuse. Of course, people are preyed upon because they're seen as different and experience really extraordinarily high rates of childhood abuse, as well as school bullying, stranger violence. They live in communities that have high violence in the community. Partner violence is the most important source of violence in the community, as many trans women, especially trans women of color, are murdered by their intimate partners. And then also violence from law enforcement, which is a phenomenon around the world we see. Next, yes, thank you. We also did an analysis. We were, again, able to use the CDC data just on one marker of violence and looking at the intersection between homelessness and violence. We know that trans women and trans people face much higher rates of homelessness than other communities here in the city. And you can see these kind of purple bodies in the middle, and this is comparing the purple to the orange, showing that the folks who are unstably housed or homeless with that purple color experience overlapping intimate partner violence, community violence, all types of physical violence that one could experience compared to people who are stably housed. And that was our pitch to go to the city and say, look, we can prevent violence if we actually have better, more targeted housing efforts. So that was our first kind of foray moving into understanding the phenomena happening here in San Francisco. So next slide, please. You can click through. So just so we all know, I'm sure folks have heard the rhetoric that's happening, but we know across the country this has been happening, really ratcheting up in 2021. We currently have over 600 bills throughout state legislatures all over the country to erase the human rights and the health rights of trans people, including their access to care. You can see in the middle of the country, it's almost impossible to safely live as a trans person. And here on the coast, including in California, it is a place where those protections are still in place and access to care at the moment currently exists. We'll see if that continues to be the case. But relative to violence, these laws and this rhetoric actually ratchets up violence. So we've seen a huge uptick in reporting of anti-LGBT and anti-trans violence reported to the FBI at rates we've never seen in the 25 years I've been doing trans health work. So next slide, please. And violence is itself a public health issue and a health issue, but it has incredibly important health sequelae, including impacts on mental health, substance use. For trans people, violence has been associated with non-viral suppression for those living with HIV, and extraordinarily increases risk for HIV because of the stress that people endure that affects their substance use and mental health, and ultimately the behaviors that lead to acquisition of HIV. So it's a really important factor in our work of understanding HIV within the community. Next slide, please. So now to get to these specific data. So like I said, TEACH was a CBPR project that was brought to community. We've been making happen since 2010 on our own and with funding from CDC and the National Institutes of Health as well. This recent cycle, the CDC actually funded after 30 years of advocacy to actually monitor CDC or HIV, sorry, in the community. It was a fifth follow-up for us, and we were able to get the supplemental funding for Robert Wood Johnson Foundation to add validated scales to understand violence within the community. So where we might have one or two questions we would ask from CDC about violence, we were able to expand that, look at violence related to law enforcement, bystander trust, intimate partner violence, a whole host of specific violence questions to really understand what our trans women experience in our city so we can intervene. Next slide, please. And that's just our funding. So really important question to kind of situate why trans people and trans women specifically come to San Francisco is they come predominantly because they think San Francisco is a safe haven. They come here expecting safety. They expect maybe not that it's affordable, but they can find housing. They expect the public to be protective. They expect the laws to be protective. They expect the services to be accessible. So that's, explains why we have a disproportionately high population of trans women in our city, because it's known in the community around the country as a safe haven. People also come for services, but interestingly, safety trumps that. So it's really important to understand that although services are here, the main reason people come is seeking safety. Next slide, please. So we collaborated with a community-based organization called Taja Coalition, or Taja Co, which was started in 2015 after the murder of a trans woman that was born and raised in San Francisco. So they do a lot of anti-violence work and housing work. So they were great experts to help us collaborate and implement and decide what measures to ask in these local questions for an HBS survey out in the community. So we conducted this study at the end of 2023 into 2024. You can click through. And these are the main findings among our trans women participants. You can see that 55% were verbally harassed in the last year, 23% were physically attacked, and 16% sexually assaulted in the last year. So these numbers in the violence literature and epidemiology of violence are extraordinary. We might see these kinds of levels of experienced violence in a lifetime among different populations. But the fact that this is just within the last year, within our city of San Francisco, most likely, unless they had very recently traveled, these levels of violence are extraordinary. So this is part of a campaign, which is why you can see a QR code, and I'll show you pictures of that a little bit later. Next slide. So who are the perpetrators of violence? So as we might expect for sexual assault, it's often casual, steady, and commercial sex work partners, but strikingly, a lot of people experience violence on the street, in a park, in a public place, on public transportation, people are sexually assaulted. So that's a huge, potentially actionable problem that we have in San Francisco, that it's not just partners that people are experiencing assault with, it's just strangers. Same with physical attacks, that half of the physical attacks experienced were by strangers on the street as well. And by their partners, their intimate partners, including their commercial sex work clients. Next slide, please. Bystander interventions, we think, are probably incredibly powerful and important for our city and all places where people experience violence publicly. So we wanted to ask, did people feel, and the words are there, so the red is agreement, or the pink is agreement, and the purple is non-agreement. So you can see that about 50% of trans women reported that if something was happening in the public, they think that bystanders would help them. However, 41% said they did not think that. So this is about community trust. Can people feel like they can be safe? And we saw a lot of extreme social isolation after COVID because of fears of violence. We've seen this only get worse, in part because of this bystander phenomena, that people don't feel safe going out. They don't feel like family, friends are supportive, at least half. And people also don't feel like police or law enforcement are there to support them if they're experiencing violence, that they can go to them and trust them to help them. Next slide, please. Law enforcement is really important. Again, going back to the data on law enforcement being perpetrators of violence and also people we seek safety from. And you can see here again, same kind of color phenomena here that people generally don't trust law enforcement. They believe that if they go to law enforcement, they will hide information from them. They don't believe that law enforcement has their best interests in mind. They don't believe that they can confide in law enforcement. About half of folks said that. And they're suspicious of the information that they get from law enforcement about protecting themselves and dealing with violence. Next slide, please. So in conclusion, it was striking to see that San Francisco is not a safe city for many trans women here. And our community that we typically sample are engaged in a sampling process where they get paid to participate and refer their friends. So we tend to get a cross-section of folks who are lower income. So that's a note on like the population statistics. But it's striking that a fifth had experienced sexual assault in the last year and a quarter physical attacks, most of those which were out in the public in the last year. We know that trans women cannot rely on the public, their family, friends, or law enforcement to protect them if they observe violence in the community, and they don't necessarily feel like law enforcement is a place of trust for them to get support if they experience violence or to prevent violence. So we thought we would see violence. We did not expect to see violence at these extraordinary levels in doing the survey. So, we feel very confident that violence is an epidemic among trans women in the city. It is not a safe haven. We have a lot of work to do to improve violence as far on the prevention side, but also on the care and treatment side going forward. Next slide, please. So what are we doing? We released a public call to action campaign. We released this on Trans Day of Remembrance, which falls on every year, November 20th. And it's a day we remember all of the murdered trans people around the world, including in our city in San Francisco. We thought that was a fitting day to release that campaign. We released it all over Muni, and we did bus ads, and it has this QR code that links out to some of our data from the study as well as prior research so people can understand how much violence impacts trans women in our city. We are communicating these data out to stakeholders, working with partners to figure out how we can use this data. We're meeting with the district attorney, we're meeting with law enforcement, we're meeting with the Committee on Violence Against Women and Girls. We are working with our health department partners to figure out how we can integrate violence prevention and treatment initiatives. We're also sharing with our community partners like KUAV who do this work. We really want the health department to elevate violence as a public health crisis, especially among marginalized populations in our city like trans women. And we think these data inform some excellent potential intervention avenues, including bystander interventions. I think there's a lot of great work to do with law enforcement, which I think they're quite amenable to education, but how to sustain that education and how to make sure that the safety interventions are working. I think this anti-trans rhetoric has been happening and it's going to get worse in our city. And I think we need to be vigilant about how that trickles into the city and how that may be related to experiences of violence in our city and how we prevent that. And then I think we have a lot of work to do around trauma-informed care, which is quite present in a lot of our wonderful clinics, but I think we can always have room for improvement to ratchet that up and make sure that trauma screenings are happening for marginalized communities on a regular basis and that they are addressed in our behavioral health and other systems to address the sequela of mental distress and substance use that often comes along with those experiences of violence. Next slide, please. So I was asked just to talk about some of our other programs. We have a lot of programs that we test as far as doing training programs. We're doing these measuring of gaps we see, like this violence assessment. We're hoping to maintain our surveillance work with trans women to understand and monitor the HIV epidemic, as well as the other social determinants we intervene upon. We also have done some prep work. We have 2 prep projects right now. These are all extramurally funded. So next slide, please. I think weekly or every other day, I get some notice of a court order related to the many executive orders that are now being litigated in court. So I think it's quite clear, comparing notes with other colleagues who are not getting these kind of orders, I think the work that we do at the federal level is quite jeopardized. We're kind of waiting every day to hear whether or not these grants are going to go away, in which case these programs go away. So for instance, we have an excellent, exciting prep clinic for trans women that we've developed. We're about to launch, but we are on hold. We haven't received our latest notice of award. So whether or not we can do those projects, so they're all at jeopardy. I think our TEACH project, we will find a way to do it one way or another, but the idea of not monitoring the epidemic in the community as well as violence and the other social determinants that we monitor on a regular basis would be a real problem for us and for our city to not keep an eye on what's happening with the trans communities. But we're top of the list as far as threats to our funding for extramural work that we do to serve the community and identify and develop evidence-based interventions and programs based off these data. So that was my update for executive orders. We have an amazing community advisory board for the study, trans-led study entirely from project leadership all the way through to our community advisory board. It's always been that way. We hope it always will be. We're grateful for their insights, especially around these violence measures that they contributed to. You can click through. We did lose one of our youth last year to violence. I'm sure we lost many more. This was somebody known to us in community. So this is a very real, tangible thing to us with the folks we know. And all of this work is really uplifted by all of our mentors and folks that work here at the Community Health Department to uplift trans health needs and services. That is it.
Do you have questions? Go.
Thank you for the presentation. Really important, critical work that you are doing, and it's a very good presentation, a lot of information, so thank you. Very rich. Looking at pages that I have aren't numbered, but the next steps, page 1, looking to DPH to elevate violence against trans women as a priority, public health focus, and then building research evidence, and then first underneath that, bystander interventions for the public. I think this is so important and so critical. I mean, violence is a public health issue, as you pointed out in the beginning. And then we have these, sadly, subcategories that have their own ecosystem and need for focus. I think this is a great recommendation for the department as a whole about these days, especially bystander interventions for the public, for the need for us to be present and helpful to one another in these times, and specificity also. But I think it is a great idea. I don't know where it is in the department yet, but I think that that is one way that the department can really help people on a kind of day-to-day present in a way, a presence in the community, like these digital billboards and things like that, and just having that visible to people as we walk and drive through the city, so that we know that we're not alone in whatever we're thinking about in terms of the violence that is being perpetrated against people, and specifically in this situation. So thank you for that. I think it's a really critical, and I'd love to hear more in the future about what those programs look like and what's going on, just kind of updates. Because again, I think people are feeling, use myself as an example, just kind of siloed and alone. It's like, you're sitting here, you're reading, you're hearing, you're seeing, things are happening, and you feel like it's, what do you do and who's there to help? And I think this really can bridge those feelings and help people figure out what we can do next to act. Looking forward to hearing about building connections with law enforcement. And I don't know if you have any more to say about that right now, what that outreach is looking like. It probably is early stages, and so I don't expect anything. But I think that's really critical for us to hear about, given that it is about violence, and law enforcement is here to protect the community against violence, but we know that it's more complicated than that.
Yeah, I'm excited about this new district attorney. Her perspective is, her chief of staff is a UCSF nurse who does trauma-informed healthcare interventions.
We're very fortunate.
Very fortunate. And so I feel, they've invited us to come speak, and they want to figure out how to, have action related to these data, both on the trauma side for victims, but also on the prevention side. So I feel like we're in a good place with a group of folks who are really open to interventions in this regard. So we're hoping to partner with them in whatever way we can support from a data perspective or intervention if they want to do that. But we have a talk with them in April. So we'll see where we go from there.
Thank you. I totally love the DPH elevating violence against trans women and against communities, vulnerable communities as a whole. I think that's really important work for the department to be doing. So thank you so much.
Thank you.
And just to note, Commissioner Christian is Assistant District Attorney for the city.
Oh, fantastic.
And if I may I call Dr. Phillip?
Sure, I've got a couple of questions
Oh,
too.
sure.
You want me to, but we can, go first because
Yeah, because Dr. Phillip is here just to address maybe like a larger DPH response, and I want to honor the fact that you're here. to
Yes,
at least
please.
I
speak
think
to it.
that would be great.
Thank you. I will be quick, Commissioner, but I really wanted to frame and first of all say I am so glad that this committee is hearing the breadth of some of the PhD work, all the way from protecting air to really the innovation and the learning that comes into San Francisco. And I really want to level set and say we are really fortunate. There are not many departments of public health that have access and have researchers like Dr. Wilson that are nationally recognized that are bringing in these enhanced data that, you know, usually a health department, a local health department would have to make inferences from national data, but now we have some local data to work from. And that these data are not just for the department. As you've heard, Dr. Wilson and team are going to other city partners, including the Office of Transgender Initiatives and the District Attorney's Office, and community advocates can then use these data as well. So while, yes, the department, we have work to do and we can immediately start putting some of these findings into how we deliver both our healthcare and our public health services and programs. We know that it's bigger than any one department to tackle these really huge issues. So I just wanted to say that we're extraordinarily fortunate to have Dr. Wilson and the Center for Public Health Research in our department and PhD. Say how grateful I am for her work and the team's work, and to say that there's this larger context that will continue to move these work forward in. And I think we as a department have a responsibility to talk about health and all policies, and these data can help inform policymakers and stakeholders about how we should be thinking about health and violence prevention with transgender communities in San Francisco, and it's incredibly valuable. Thanks. Thank you.
Yes, go ahead.
Dr. Wilson, thank you for the presentation and for the work that you're doing. Most of my questions were answered. This is just a quick general question. How can the general public help? What can we do, just as residents of the city, to let people know we're your ally? We are there for you if you need help. What can we do?
I mean, I think a big piece of it is visibility. And I think this idea of like social norms changes, you know, some kind of like campaign where we state that we are here to support each other. I think there's something at that kind of social norms change level that has to happen, that we are a community that's proud and we want to represent our values. And part of that is big bystander interventions are exactly that. They can be social marketing campaigns that explicitly say this is the kind of violence that is happening. We find it unacceptable. We as a community need to intervene. I think a lot of violence interventions are about calling out other people in. This is how you do that in a safe way. This is who you call. This is where you go. These are things that can disrupt violence. It's interesting, like in our HR training, we get a lot of that around like sexual harassment disruption. So it's like things like that at a bystander level that there's a lot of evidence that those kind of interventions work. I mean, they take money and they take partnership to get that out there. But I think a big piece of it is trans people are here. They experience extraordinary violence. That's unacceptable. Here are 3 things you can do to interrupt that violence. Here are 3 things you can say when somebody's experienced. Here are places we can send you where you can get services to deal with the stress from that.
In the numbers that you gave us, the fact that they don't trust law enforcement, and I think a lot of people don't trust law enforcement. How can we change that narrative where if I witness something, I feel comfortable enough that I can approach law enforcement and say, I saw this happen?
Yeah, big question. I mean, I think part of it is these historical experiences. Like a lot of our healthcare avoidance we see among trans women is because they've had bad experiences. We know XYZ Clinic has an amazing clinician who is extremely trauma informed and wonderful, but they've already been burned in the past. So how do we reestablish that commitment? Is we have to have exposure. They have to have exposure with people who are law enforcement people who they can see can care for them. I think is a big piece of it. My son's actually in the DA's fellowship right now, and a big piece of it is connecting with youth to create positive relationships and experiences with law enforcement. And I think I have a good friend who's at the California Department of Public Health who works really closely with law enforcement, and she's a trans woman, and her experiences of training have really changed her life and her staff's life and all the people that she brings into the fold to create those connections to where people can rebuild trust because those historical things you can't do anything about in that moment that will forever live until you actively engage community. And the great thing about our community, I always say, is we have this is 3,000 people are represented in this community of lower income trans women. Like, this is a community we can wrap our arms around and truly engage most, if not all of them. So to me, it feels like an opportunity to really make radical change by wrapping our arms around this relatively small community. And there are great things we can do with that number. So I think it is a rebuilding of trust.
Thank you.
Thank you.
Thank you. And I've got a few questions too. On your slide of most trans women in San Francisco have experienced violence in their lifetime, in the 2016 was 64.2%. What was the population number that the 64.2% was based on
The sample size was around 300 probably for that data set.
for that one?
Yes, but we like to say that that's we do kind of a poll in how we sample. So we like to get a representative sample of the community. Our samples are typically very diverse, representing the community here in San Francisco. It's, a third African American, a third Latino, a third, white, and then mixed race folks and other race folks, but mostly, a lower income sliver of the community, but they're really racially diverse, gender identity diverse. So we feel like they represent the community. We don't have a census, so we don't know for sure, but we believe
Sure,
it does.
I mean,
Yeah.
that's reasonable, but I'm also curious, let's say give or take the 300 in 2016, and then in the 2023, 2024 cohort,
Mhm.
330 that the data is based on, I'm
Yep.
assuming. Where do you gather that cohort from? I mean, what are your feeders?
Yeah. So we do this thing called respondent-driven sampling, where we give a small group of people coupons and they refer their friends, and they're incentivized. They get incentives for friends of theirs that show up who are eligible for the study. They all come to 25 NS. It's a building that's very familiar to the community because we've been running studies out of there since 1997. And that's how they recruit. And we were supposed to get to, I think, 300 people per CDC recommendations, and we went a little bit over.
Which is great.
Yeah.
I always like to get the baseline there.
Yeah.
My other question, because I am also concerned about your funding.
Mhm.
In what you had talked about and delineated in your next steps, et cetera, within DPH, do you see, I know this is kind of fair, not or half fair question, but with my concern with the funding constraints, have you prioritized what you feel should be the priorities for DPH to be able to implement the necessary next steps? But I'm just concerned with that, put it that way.
I mean, and
I don't know.
Pivot to Susan as the one that holds these
Yeah.
decisions. Yeah.
I'm a psychologist. I treat a lot of kids, especially adolescents, that I send to UCSF's clinic and others. And so I guess I'm doubly concerned, put it that way, especially for the adolescents that I'm working with. So I just,
Commissioner, I think that that's a really important question, and I don't think we know what the ramifications will be depending on which funding is cut, how deeply it's cut, what we'll need to do. And I think that at a minimum, what we can do is what Dr. Wilson said. We need to start making these connections, right? There's a citywide push. The mayor has a directive to talk about housing, to talk about these types of things. That can be informed by these data that really show, look, there's an additive benefit. There is a strong benefit to potentially decreasing exposure to violence for trans women by really making sure that housing is available. So I think we need to keep having conversations and making the connections, but we are all working in under a large amount of uncertainty, as you know, as we all know, and that's what is going to make it difficult to understand what parts of this work can we push forward. But I think we have to keep the thread and the through line going in whatever opportunities we have.
and I know our committee would really like whenever it's possible that you are able to implement one of your next steps, just to communicate to Mark to let us know, because it's something that obviously you hear from our questions we're all concerned about. One of the areas when you were talking about training with law enforcement, I think is needed. It's great. I would also highly recommend training for all of our hospitals, maybe not San Francisco General, since they're pretty well aware, but the other institutions, their emergency room staff. I think that would really, for women that do show up in the emergency room, I'm not totally sure, since I also do for adolescents. I get those calls from the ED staff often about trans kids, or they present obviously suicidal and how they interact with the gender issue. I'm just throwing it out as a possibility that, with maybe your current funding, that would not, raise a red flag. I don't know what to say, but I thought something like that would be extremely helpful for people that show up in the ED.
I love that idea. I think there's actually a PCORI RFA out around that with the health system. So that might be a great fit. I think that would be a huge, we do a lot of that around HIV and infectious disease, and this would be really important to intersect folks at that moment. So I love that idea. Thank you.
Yeah, just a thought, but your work is extremely important, and I just express my hope that it can continue, in that outside funding, such as Robert Wood Johnson, could continue to be available, and maybe partner with other foundations that would be able to support the needed work. So, so thank you very much. But any kind of updates to shoot to Mark, I think we would appreciate.
I'd love to do that. Thank you so much for having us.
Thank you for your.
Thank you. Thank you.
Thank you.
And we were remiss in not calling public comment. So is there any public comment on this item in the room? Okay, thank you. We can move on to item 5, emerging issues. Any public comment on that item? Commissioners, any comments?
No, I'm just wondering, not that I have public comment, I mean, a comment is that what you had just sent, Mark, to us, what the mayor just, his statement, and whether or not we make sure, wait a minute, I got to pull it up, or you can, the press release that just came out with with DPH and the vision for tackling San Francisco's homelessness and behavioral health crisis, that the trans women, and not only with homelessness, but behavioral health and violence, is somehow integrated in this, Dr. Phillips. Somehow it's the flags raised that this is also an issue, because that's the population that's the most vulnerable, according to your statistics. Am I correct?
Yes, I think he said in findings.
Yes.
That it is a very important community, important population to work for and work with.
Well, and the homeless data too. So it's just that you raise the flag to the group and to our, director, that this should also be on the wavelength of this.
Thank you, Commissioner. Yes, I will do that.
Yeah. No.
And I also will include the president, the commission president, vice president meet with the director Sy weekly. I'll add this to their agenda just as a reminder to help back that up. Yeah. All right. So item 6 is public comment. This would be a time when anyone in the room can make comment about something that's not on the agenda today. All right. So now we're at a consideration for adjournment, commissioners.
Second,
All those in favor?
aye.
All right, please give me about 30 seconds to take us out of the room. Thank you, everyone who attended and presented today. And thank you again for attending.
Yeah, Dr. Phillips, can I just, come on over.